Hey everyone, so I'm with a good friend of mine, Trevor Montgomery. He is an expert in dry needling from New Zealand, and so he's going to help me because I've had some low-grade, low back pain, kind of irritation for a while. And so, Trevor, what would you say, quickly, nutshell, dry needling?
Dry needling's, it's the way I think about it, it's like a reset tool. If you think of each muscle as kind of like a computer,
Yeah.
and you've got a corporation and you've got a whole bunch of computers in there, and you crash a few, the company still runs, just doesn't run very efficiently.
Right.
So dry needling is essentially goes and resets those muscles, then you can get them back on the network, and then the company can run better.
Yeah.
That's the best explanation I usually use.
Excellent. So, without further ado, we're going to just treat my low back and see what Trevor finds in terms of the trigger points. So I'm going to take off this mic, and Trevor has full access to what he needs to do.
Sweet.
So where do you want me?
Cool. We'll have a look at check your
Yep.
pelvic tracking first of all. Okay. Get your right knee to your chest. Alright, down. And your left one. Down. Cool. Slide your left hand down your left leg so you're bending to the left. Cool. Bend to the right for me. Back to the middle. And then bend backwards. What does that feel like? Is that?
Yeah.
Just hinges across here.
Yeah.
Alright. Just turn and face me. Just run a quick. I think they might have changed the SFMA screen a little bit, but we'll see what happens today.
Yeah.
Let me know if any of this is particularly sore. Mouth closed, chin on your chin. Good, come back up. Head back as far as it'll go. Back to the middle. Turn your head to the left. Tuck your chin on your collarbone. Oh, that changes. Oh, it's a bit tight. Opposite way. Turn and touch. Oh, it's tight too. Okay. Opposite shoulder. Opposite shoulder. Opposite shoulder. Opposite shoulder. You're both a bit tight. Face that way. Feet together. Knees straight, touch the ground in front of your toes. Come back up again for me. Arms up by your ears. And bend back as far as you can. Come back up. Do it again for me. Come back up. Cool. Arms facing me, arms by your sides. Turn as far as you can to the left. Right round. Right round. Back. Good, thank you. 90 degrees, hold for 10. Close your eyes, hold for another 10. Down, switch sides. Eyes open first. Eyes closed. Alright, and go on your back for me. Get up that end, sit up that end for me.
Head here?
Yeah, that's that end, it's perfect. Bend your knee. Tight some. Does that feel like left or right? It's okay.
Oh, that's right. I feel just a little
Pause
bit
in
of
it.
tension yet.
Yeah, this one's tighter.
And that one, for sure.
The left side's the one that's been bugging you more?
Yeah.
Yeah, that makes sense. Cool.
Yeah.
Alright.
Talk to me, Trevor.
Okay. Both ear side joints tracking up. So you've got left low back pain. It's had it for on and off for 6 months. Comes and goes.
Yeah. Comes and goes.
What brings it on?
I probably notice it most with surfing.
So when you surf or after you surf?
More after I surf.
Okay.
Surfing's fine. Squatting, deadlifting, lifting is fine. Yeah.
Posture, sitting, standing, lying in bed.
I would say if anything, maybe after long standing.
Long standing?
A little bit more sore.
Starts to get sore.
Yeah.
It's mostly left sided though.
Yeah. I mean, lately it's been bilateral, but usually typically it's left-sided.
Cool.
Yeah.
Seen this? So what we're going to do
How's the
is...
pull?
Eh?
Traction? Which one? Where?
It's about L23.
Left or right?
It's 2.
This is what I mean. This is an expert telling me that it's about L2, L3.
That's 3.
See?
Yeah, that's 3.
Mm-hmm. Expected.
Eh? Expected. Alright, so what we're going to do something unique.
Yeah.
So we're going to dry needle wedge and use a slightly different variant technique that I've been working on,
Okay.
which will fascially stretch this, reset the fascial line that these muscles run on, and are keeping this pelvis out of position.
Yeah.
And I'm going to get my good friend, Yellow Zenfeld, to come in here, and he's an osteopath, so he's going to look at all your organs and viscera and see how that moves and see how that relates to what's presenting.
Awesome.
Be really interesting to see what happens having someone who dietarily wise eats really well and what you feel. Quite fascinating. I'm really interested to see what's going to come out of this.
Yeah.
Nice. All right. Let's unravel some stuff. So this weekend they've been talking about fascial line. Fascia's getting a big following, right?
Yeah, yeah.
Because as they say in the past, used to just cut it off when they did, cadaver studies because it was inconvenient.
Right.
But it's highly innovative and it runs through your body in different lines. This is your deep front line.
Mm-hmm.
So we're going to go, it's tibialis posterior, some foot intrinsics. Tibialis posterior, popliteus, adductors, iliacus, pectineus, psoas major, up through your diaphragm, up through your medius dinum, up into your throat. So I can release anywhere along that line and it'll have an effect on how your pelvis tracks. So we're going to start down here, which is tibialis posterior. Looking for aching and twitching. If it's electric shock, let me know, but mostly it'll just ache.
Not feeling much. So if you're afraid of needles, obviously it's not for you. Oh, that's nice.
Here we go.
Yeah. So, not much feeling, just almost like a. Basically, I'm getting a referral, so basically it's going down to top of the foot at this point. Oh, that's pretty achy there. Oh. Wow.
Breathe. Have a look at this. See this? Remember what they did before?
Yeah.
They were reversed.
Yeah. It's kind of like voodoo-ish a bit.
Wait, so are you saying his foot was
So
in a
it's-
different direction and now?
So the musculature that's overworking to compensate for the change of pelvic position and whatever else is coming down was dragging that in and just starting to loosen those fascial lines as things starts to change. So
All of a sudden his...
it was square and now it's turning out. I've got this one, I'm holding this one squared. So I can do the technique, but
Are you just holding it there now?
yeah.
Yeah.
So what we're doing is we're binding the fascia
Okay.
and it'll stretch it and rehydrate it. Your nervous system reorganizes itself.
Explain to me what you're feeling.
So it feels like a referral, so down through the top of my right foot, and it almost feels like it's just almost like not quite muscular work, like you're getting a burning, like lactic acid, but it's more like an ache, almost like it's a deep, deep ache as he's. So you're addressing the trigger point, or
Yeah, so this
this
is going to be picking up some of the trigger points in the region.
right.
What you activate when you do this is so C fiber is achy pain, sharp is A delta fiber, and
Okay.
you've got the A beta fibers,
Yeah.
which is this dull heavy. What Chinese describe as that chi sensation, that dull
Okay,
heavy warm
right.
ache.
Yeah.
That's
yeah,
kind
yeah.
of what you're getting with this.
Okay, so I'm getting that sort of chi sensation.
And activating A beta fibers helps release GABA, which
I
is
see.
inhibits. So it's a neuro and muscular tone regulator as
Yeah.
well. So it'll drop muscular tone.
Okay.
Starts to soften out that line.
Cool. Yeah, it's almost like some of the traditional Chinese practitioners, they talk about some of the Chinese people, they think, oh, you're good if you get that sort of quote unquote chi release, right?
Yeah.
Yeah.
So often what happens with Chinese acupuncture, if you're really low in energy and it's not going around your body, when they do acupuncture, you hardly feel anything.
Ah, gotcha.
But the stronger you get, the stronger the reaction, the stronger the chi you get
Gotcha.
over time. So you know when
Yeah.
they're doing well because they put needles in and say, oh, it's really achy today. Well, it's
Right.
good chi. So you get energy's coming back up.
So we're just gonna hang out here all day like this?
Yeah, we're going to shift legs. So when we looked at your leg, what they call leg length discrepancy,
Yeah.
your right leg and both legs are the same length.
Oh, holy
Take that
cow.
one out.
It
Now,
felt like you. It felt like it was kind of barbed coming out.
yeah.
Yeah.
So sometimes the fascia, when you have to unbind off the thing,
Yeah.
it catches a little.
It felt like it was catching.
Yeah.
When you pulled out, I was like, oh.
Yeah. So if you look at your leg length now, this one's shorter. So by softening that out, this has started to reseat itself.
Yeah.
They use colloquial terms, pelvis in, pelvis out.
Right.
This thing is a positional fault, but it's because this fascia is dragging it, keeping it out of position.
Gotcha.
Have a stand up, we'll see what the difference is in
Yeah.
terms of how they feel to lift. Okay, so lift your right knee to your chest for me. Okay, down, left knee. What do you feel different? I can tell you what I see, what do you feel different?
Right now, I feel
It's lighter
lighter, but I feel a massive release on the whole
system.
lumbar area.
Can you feel this leg's much lighter and lifts
Yeah.
higher with
Yeah.
more ease than this one here?
Yeah, this definitely feels a bit heavier
Yeah.
to lift.
From a tracking perspective, we'll lift this leg up again.
Yep.
This now drags down,
Mm.
come back up,
Yep.
which is what it's supposed to do.
Right.
And this one here tips sideways. So that's just one side. So we can do the other side.
Okay.
I'm going to come up and do another couple of spots in that chain
Yeah.
and see how much we can get out of this.
Okay.
Okay.
So tell me what you're feeling there when he was testing you. You felt like your leg was
Yeah,
lighter?
so it's one of the tests to see where the SI joint is. And so what I was feeling was basically his thumbs on part of my pelvis. And, I've been standing for the last 3 days, and so there's been a lot of discomfort on both sides on my back. And I felt quite light as I was standing there. Oh. So now I'm feeling that sort of little bit of pulsing as he's getting to the spot. I almost would feel like my foot wants to do this a little bit.
Twitch.
Yeah, or like a fish out of water experience a little bit. For right now, this one definitely does not feel as bad. I mean, the right side was probably at a, well, I take that back now. The right side was probably about a 6 or 7. This is maybe climbing a little bit to maybe like around a 3-ish, whereas the right was okay, I take that back now, it's like a 4 now, as he's finding the spot a little bit. But now that he's doing this side,
Always one way.
the right side definitely feels as if it, like I remember you told me last time you treated me a long time ago, it's gonna feel like you worked out.
Yeah.
Like the anterior tib, like just that whole region just feels like it's just toast right now.
Yeah. So different to, it's the last time when I dry needled you, which
Yeah.
is basically you insert the needle and you shift it around looking for trigger
Right.
points.
Yeah.
So this is this fascial stretching stuff.
Ah, okay.
So you still get the trigger point release.
Right.
It's more intense typically when you do it.
Yeah.
Post treatment soreness, significantly less.
Oh, so even less.
Yeah.
Ah, just because less.
Pretty much. Yeah.
Yeah. Okay,
Less
gotcha.
mast cell degranulation, so you get
Right.
less release of CGRP, substance P, a whole bunch of stuff.
So then with something like this, because you're working the fascial system, so would you obviously tell someone they would take off 24 hours from exercise or running or anything, or?
It's all athlete dependent.
Okay.
If you needle my hamstring, either way,
Mm.
I'm not running for 2 days. It's stiff, it's sore.
Yeah.
Needle a runner's hamstring at 10 o'clock in the morning. They go for a run at lunchtime. I felt great. And you go, really? It's just every
so
athlete's
no hard
different.
fast rules on that one.
No.
Yeah.
No.
Okay.
Biggest key is hydration afterwards.
Yeah.
Magnesium.
Yeah.
Decrease alcohol consumption. Get more
Right.
sleep.
Yeah.
All the stuff
Typical
that Rob
stuff
already
that I already
does
recommend.
and preaches.
Yeah.
So as an osteopath, what are you looking for?
At the moment, it's interesting to see what Trevor's doing in the fascia, and the fascia is not just covering the muscles and the bones. It also covers the entire nervous system. It covers the organs, the entire viscera coming up, and it's going to be very interesting to see what the techniques on the fascia and the lower legs is going to do on what the movement of the organs is going to be looking like. So I'm looking forward to that, to see how Robert is. That's one. I know his nutrition is good, but that doesn't say that, that his organs are good.
Yeah.
If he's had some stress years ago, or maybe in the last couple of weeks, it might be that the organ has been swollen up in its fascia a little, and it gets stuck. It doesn't move that well anymore. And if it doesn't move that well anymore, then you can work on the muscular system, but it might not work as well as if you work on the visceral system and the fascia surrounding that. Now the nice thing of our cooperation, Trevor and me, is that if he's working with the needles on the fascial system and the muscular system, and I work on the viscera fascial system, then everything opens up. And it doubles the entire system. It's been doing it the last couple of days a couple of times. We don't work that much together since he's in New Zealand and I'm in Austria. So, and Robert is in San Diego, obviously, so then we have a little problem to team up on that. But it is very interesting to see how the effects go up. And you see a very nice rise now.
Yeah, that's a lot easier.
Easier now?
The ISG is low.
Yeah.
This one.
Yeah.
Nice, this one. Okay. Been backwards. Oh, that looks better.
That feels
different.
I mean, that's night and day difference.
Yeah, you were
Before.
hinging right across here before,
Oh,
you had a
yeah.
massive knee bend.
Yeah.
Now you can actually start to extend through that sacral leg joint.
Yeah.
It's not even half what we're going to get out of it.
Yeah.
Slide your left hand down your left leg so you're bending to the left. And then down to the right. How does that feel?
Yeah,
Getting more glide through here now, which is good.
And that's definitely less tension
Nice.
to both sides. Yeah, for sure.
Curious, turn and face up. Turn your head to the left, touch your chin on your collarbone. And to the right. That's still tight. Okay.
It's still tight with that. That was different though, for sure.
Good.
On your back. Yeah.
Actually, I'll whip your twigs off. Yep.
So it seems like it kind of does go hand in hand.
Oh, yeah.
It's unfortunate that you're,
Yeah.
you know, far apart from each other. You guys are a dynamic duo.
Oh, trio. Trio. Because don't leave nutrition out.
Oh.
Because if nutrition doesn't work, therapy is going to be a lot harder.
So you're curious to work on
So I
him
can run
because
each
you
of
know
the
that
line.
Robert
What's
eats
that?
really well.
Yes.
So just to
Best
see
bang for your buck
how
is
much,
to pass them pizza.
where his
Well,
organs are.
even people who eat clean have problems.
That's why I keep hearing you work on Pictinius.
So it might be an old
Iliacus
virus
is
thing,
good.
bacteria,
Iliacus.
or anything. And if that's not moving well, it is very interesting to see what happens when I work on him and how fast he can get back to normal.
Oh, I see.
Yeah.
Recovery.
And I think his regeneration after treatment is going to be a lot faster and longer holding than someone who eats crap and has bad connective tissue.
I'm laughing at this one.
So this is PG rated, so you can tell me like what you're doing right now.
Oh my god.
Trevor?
Okay, so this muscle is called pectineus. So it sits inside the hip flexor. And it's one of those muscles that you don't learn much about, they don't speak about it too much, but it has a massive impact on how tight this fascial line is. It's called the deep front line. It's Thomas Myers' work. This thing is really, this is one of those guttural aches. This is kind of seat of your soul ache, this one. This gets well in there.
How you doing, honey?
I'm focusing on breathing
Good job.
at this point.
So can I do this at home if he doesn't listen to me?
Yeah, I can give you some.
Yeah. It's just
Just
it's
thread.
not painful. It's just
Awkward?
awkward, and it's just sort of that deep sort of discomfort in the area.
You're
And it
supposed
feels
to
like it's just
be-
fatigued
You're
in that
supposed to
area
say,
at this point.
This feels fabulous. Everyone
Yeah,
should do it.
yeah, I don't know if it feels fabulous, but
The result.
the result is what I'm looking forward to.
Now,
thing is-
when a muscle's functioning well and the fascia is gliding well, it doesn't hurt. Like you feel nothing.
Oh.
The patients go, "Oh, is it in yet?" And you go, "Well, yeah, I'm looking." And if you try and bind the fascia, it won't bind. It won't catch on the needle. It's just smooth and keeps spinning.
Gotcha.
It's definitely got a bit on it. Nice.
Have you had people where you've had them on and you're like, they're in pretty good shape that you don't need to do a whole lot?
Yeah, you know what? When you run things like the SFMA, the screens and stuff, they pass them all. I'm one triathlete I remember distinctly. His mother said, "Can you screen my son?" You know, I said, "What's wrong with him?" She says, "Nothing." But I just wanted to make sure he's okay because he's during triathlon, he's doing long distance. So he came in and I ran a whole bunch of screens, including the SFMA, and he was good. So I gave him some advice in terms of maintenance. But yeah, when they're looking after themselves, for me, physical utopia is everything I do on a daily basis. I do really, really well. So daily living maintains me. I don't create imbalances. Things don't get short. Things don't get weak. It's just daily living. So it's like kids do. They squat and they roll and they jump and they do all those things, and it goes a long way to maintaining movement in the body, which is great. So.
Will he need more than a couple of treatments for this? What do you foresee?
It's one of those interesting questions. If you address the underlying cause of the problem, once you reset it, as long as that cause is addressed, it doesn't come back again.
Did that hurt?
That was interesting. I was like, whoa. Felt like he kept pulling it out.
So some causes are habits, poor posture, poor breathing. Some causes are like visceral dysfunction. Yellow's going to have a look at in a minute. And it's a case of figuring out which is the cause or the causes, because there's often more than one, and how they relate to the ongoing or the recurrence of the problem.
Yeah.
So.
That makes sense.
If you look at the feet right now,
Oh yeah.
I mean, yeah.
that is totally relaxed, maybe even too far to the outside rotation,
Right.
external rotation.
All right. Now see, it's gone longer. So they went short. Now it's gone decompress this way. So it's derotated this way and it's decompressed this way.
Right.
So stand up, see how that tracks now. Okay, right knee to your arms changing.
Oh, jeez. That's ridiculous.
What's ridiculous?
Because
I'm looking
before,
shy.
when I did the flexion of the hip, it was right around here.
Okay.
But now I didn't even think about it on all the way up here.
This one?
Yeah.
And it's good, but it's
Yeah.
not as good as that one, and you can see it
Right.
tightens a little here. You can feel it can drag you under, with
Yeah.
that just like shoom.
I mean, it's just massive difference.
Match up here.
You can sprint now, honey.
Yeah.
Kick those legs up. Switch spots.
Yeah.
Yeah.
It's amazing how functional we can be with dysfunction.
Right. That's a great line there.
Because body's best and worst trait is its ability to adapt. So I can't do it one way, I do it another way.
Yeah.
Finally, when it can't do it any other way, it complains.
Right.
So,
Yeah. That's so true.
one of the analogies I use is like walking backwards. We spend our lives walking backwards towards the edge of a cliff. We don't have to reach that edge until a foot slips off.
Right.
Or we end up at the bottom. And people like Yellow, like myself, and like you, it's about how far we can get him away from the cliff edge and get him walking in the right direction.
Wow.
Painful?
Man, this one is pretty gnarly.
That's where your deep breathing kicks in.
Tender. Tender? A little bit tender.
Just a little tender, honey.
Master of understatement.
Yeah.
So how do you explain it to just an average person what you're doing? Because you're in this field, but for a person, they're like, oh, is this acupuncture?
So, yeah, good question. So, there's three kind of types of things you can do with needles. So, classic acupuncture or traditional acupuncture is steeped in tradition. It's 4,000 years of observation and trial. And they describe it as energy flowing through the body, through different channels, and blockages in those channels create some form of dis-ease.
Mm-hmm.
And so the acupuncture I mean, there's different subsets of how they think, but the acupuncture to unblock those channels and get that energy or that chi flowing freely through the body. When you do dry needling, for me, and the best way I describe it when I teach, it's a reset tool. Your muscle's dysfunctional, you get rid of the trigger points. When a muscle has trigger points, it fatigues quicker, it's tighter, it's weaker, it takes longer to recover and longer to relax. So when you get rid of those trigger points, and it doesn't play nicely with others, it doesn't coordinate well from a motor programming perspective. So when you get rid of the trigger points, suddenly, it can do its own job, but you can also get it to play nicely with others. So it reintegrates into the system really well. Segmental acupuncture or segmental needling is another set, and that's using traditional acupuncture points, but from a Western perspective. So they've done studies, PET scans, and functional MRIs of the brain that show when you put certain needles in certain places, acupuncture points, you get changes up in the brain. You get changes in blood chemistry, and you get changes in neurodynamics. So, I use segmental acupuncture for chemical modulation. So if I want to modulate the immune system or the inflammatory system, so swelling, blood flow, autonomic nervous system, I'll use segmental acupuncture. If I want to reset some stuff and get the system working musculoskeletally, then dry needling or fascial stretching works the best bang for your buck in the time frame you've got. That's the best way to put it. There's lots of ways you can change things. You can trigger point things, you can do ART, but for me, I want to clear that out as quick as I can so they're going to address the underlying causes.
Yeah, I
Talk
love
about
that you get to
exercise
the root
and
of the
posture
problem.
and all those things.
Do you have a moment, honey, that you're feeling where you're like, please, can you just pull it out because it's just uncomfortable? Is it ever at that point?
Oh yeah, like right when you put it in, I was like, oh yeah, take it out. But I do know that it's not about no pain, no gain, but what it is that I know that this is a therapeutic moment where, yes, there is some discomfort involved, but I know that the outcome is where just, before this, you saw that there's a massive difference in terms of my hip flexion in that standing position. So obviously I trust Trevor because he's an expert. And so, yes, it's a little bit of discomfort and maybe quite a bit, but I know there's a reason behind that.
There's a light at the end of the tunnel. That's what he's looking at.
I use the term, no therapeutic pain, no gain. If I could find a technique that worked as well with less discomfort, I'd use it.
Yeah,
but I haven't so far.
Yeah.
In regards to people who can't cope with that level of intensity, you can always step it down. Put a new lever, you don't twist it. You don't jig it around 20 times. You get 1 or 2 twitches, then leave it in. So there's lots of ways you can modify it based on what the patient can tolerate, what sort of result you want to achieve, and even on the day. Some days are like, I can't cope with this today. We'll do something else.
I see.
Trevor, a question.
Yes.
You just described the different ways to work with an acupuncture needle. Now, trigger points and some acupuncture points are the same thing.
Yeah, about 80% of all acupuncture points are actually on motor points, actually on trigger points.
Okay.
Yeah.
Now, the body doesn't know what kind of philosophy you have
No, it doesn't.
pushing the needle.
Yeah.
So
it's about
what you're taking on.
It's about what sort of stimulation you give it, in terms of if I'm looking for trigger points and twitch responses. Trigger points, the motor nerve comes down to the muscle and it comes out like branches of a tree, and each tip has the potential to form a trigger point. So when you move the needle around, it can go twitch, 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 twitch. Now, ideally you should get rid of all of them, but that's unrealistic. So what we say is we get as many twitch responses as we require to get a change in function. That way you're not completely smashing a patient and you can't walk for 4 days, because that happens if you totally overload them. So the type of stimulation you give a needle, also the intent, which sounds a little bit ethereal, but the intent you have when you're doing this makes a big difference. So you're transferring energy between you and your patient all the time. And if you have the wrong intent, it actually doesn't work. They come back the same or worse, even though you did the same technique. Which is kind of crazy. But that's what it's about. Alright, that's a clip. Bend your knees, lift your bum, pop it down. Yeah, I'm pleased with that. Have a stand up. right knee to your chest.
Nice.
Left knee. Nice.
Yeah.
Bend backwards. How does that feel? Oh, that looks huge.
That's just massively different. Yeah.
Slide your left hand down your left leg, so you're bending to the left. And to the right.
Yeah. That's different.
Nice.
Yeah.
Alright.
Yeah.
Two hands face me. Just check his neck. Try and touch. Other way. How's that feel?
Yeah, that's much better.
Opposite shoulder. Well, that's different. Yeah.
Oh, yeah.
That one. Yeah. Oh, that's different as well. Nice. So before your elbow was sticking out the side, and it's like, oh, I'm up here now.
Yeah.
Try your surf position, because that
The what position?
going on your surfboard, like if you're going to paddle.
Oh, yeah.
Yeah.
Yeah. Oh, yeah, there's nothing there.
And if you had to jump up onto your
Yeah.
board,
Yeah. And I can tell, like, just sweeping is going to be much easier to get the position.
nice.
Yeah.
Cool.
Yeah, because that is,
Yeah.
that position, yeah.
And you're not pulling against resistance now.
Yeah,
So
and that's the thing is I was doing this every so often, you know, the whole 3 days, and literally I probably am a 0.5 at this point, where she's a 6.5, 7.
Right. Nice. Right, palm off.
Unbelievable. Yeah.
Come on, Robert,
Now,
let's do this.
yeah, wait. He is a man that I've known for so long.
It's turn.
I've actually never had him treat me.
Yet.
He's the osteopath. Yeah, yet. In terms of the internal organs. So, real quick, in a nutshell, what would you say you're going to be doing here in terms of?
Okay, I'm gonna
Here.
keep this just to the viscera, just to the organs. Usually,
Right.
osteopathy is looking at all three different pillars of osteopathy. So that
Right.
would be the movement system like bones and joints.
Right.
Neurological system. The second thing would be the viscera, and the third system is cranial sacral movement. That is a very interesting part too.
Right.
But let's keep it to the viscera now. All right.
Sounds good.
Okay.
All right.
Now you can, if you can put your hand on that side for
Yep.
me, please,
No
because
problem.
my sugar hand is the left one,
Yep.
and that's the one I'm going to be controlling with.
No problem.
But the first thing, I got to retest a little for myself
Sure.
for what Trevor has
Absolutely.
been doing, because I don't trust his hands.
Exactly.
Yes, I do, but I need to feel it myself so I can feel the differences afterwards.
And what are
Right.
you feeling for?
Oh, he just said L2, about L2, L3. I'm feeling more on the left side than on the right side, so there's a little difference. Just feeling connective tissue. How does the connective tissue feel for me? Is it normal? Is it stiff? Is it too weak? Did it used to have more muscles, or is it about normal for him? So the sac, is it blown up or is it caving in? A very important point for me to control is the sacrum, because the sacrum, in German it would be called the crossbone. So it's a crossing point for a lot of fascia. A lot of fascia coming from up there, coming to the sacrum. That's a fixed point and then going down the chain. So if there is something going on in this fascia, it will, let's call it, pull me in the direction of dysfunction. So what's happening here, if I would show this with this hand, is that it's going in this direction. That doesn't tell me what is wrong, it just tells me that something in this region is not okay. It is pulling. So the fascia there is still in some kind of trouble. Now, I trust Trevor, so I can depend on his work that the muscular system is okay now. He tested that, and that functions well. But if there is a dysfunction in the exact same chain, because the body doesn't divide in muscles, and we have other fascia for the organ system, and we have other fascia for the neurological system, it wraps it all up. So I need to look for dysfunctions in the same chains that he's been looking at to see if we have to do something there as well. Now the thing is that I usually work viscera first, and when needed I use some needles.
I see.
Trevor is a lot better with the needles than I am, so his philosophy is needles, and if I need to do something, I'll see what I have to do afterwards. Can you put your hand down? Your
Oh,
left one?
yeah. Side or?
Oh, anywhere you want,
Okay.
just not here.
Sure.
So I'm just feeling what's happening, and as soon as I go in there deeper, I feel that this rotation that we just had moving in that direction loosens up the feeling in the sacral bone. So in deep there, this would be left kidney. The intestines feel really good. So that is something, if I would say this is normal, then that would be it. Don't see that a lot. So your nutrition really helps. Kidney.
So the nutrition works.
I gave that pointer good, I didn't.
I didn't pay him to say that.
The thing is that secretion is very often a little problem. Now, I also depend on that you are working with the water and sea salt, so normally that would be a very good relief for the kidney. But you feel that there is a little discomfort here.
Right.
Maybe little is not the right word. It's the same as with Trevor. If it's okay, it doesn't hurt.
Right.
This is not okay.
Yeah.
You feel it blocking here.
Yeah.
What are you feeling?
I mean, it literally feels like you're on the kidney, right?
Yeah.
Yeah. I mean, there's a lot of pressure there, but it's not like pure pain, but it's just sort of like a just discomfort as he's there with the pressure of his hand.
Do you just feel it locally, or?
Yeah, locally. I was just checking my toes. I don't feel anything there.
Uh-oh.
But I can tell you, I can tell there's not a huge amount of pressure, but a lot of discomfort. Would that be correct to say that?
Yes.
Yeah.
Very often patients feel their pain in the back. You had this discomfort in your lower back, but since the muscular system has already been treated,
right,
you don't feel it right
now.
now.
I primarily just at that point of contact that you have, that's where I feel uncomfortable.
Now, if we go to this in the anatomy, the kidney lies in a pouch like a sock, and during breathing, this kidney should be moving 2 centimeters up and down every breath you take, right? Breathe in, kidney goes down 2 centimeters, breathe out, it goes up again. The dorsal side of the fascia, so the back side, it shares with the hip flexor, the psoas. Now, if this pouch, for some reason, doesn't work that well, it means that the psoas cannot work as well. It starts to get tense.
Yeah.
Now, if the psoas gets tense, usually you have to act and counteract. So its counterpart, the lumbar erector, starts to get tense. If that gets tense all the time, you told me you've just been standing a lot, you have not been moving as much as you used to do, this tenseness of both muscles gives a compression in your lumbar spine as well. Okay? If a muscle flexes, it gives compression in the joint. Just works that way. Right. It's like an elastic band. You put on there, you stress the band, it gives more compression. So by loosening this one up, we're actually also working on the psoas. Okay, it's one system. And you feel that I'm giving a lot more pressure now than I did before.
Yeah, I felt at one moment there was sort of a release.
Yes.
Like the discomfort, like right there, like the discomfort kind of went away. Now it's kind of back a little bit. So at this motion, what are you trying to do with the kidney at this point?
Get it mobile in its sock, in its pouch, in its fascia.
Gotcha. So it's sort of like it's stuck in the.
It is stuck in. It's stuck in the pouch.
Okay.
And if it's stuck, if it doesn't move well, anything in movement, if it doesn't move well, it doesn't function well, it will give a disturbance.
I see.
And it starts to move well now. And if this mobility of the kidney is good again, during breathing, you will have the milking of the kidney. So it'll help your kidney to work better, to detoxify your body.
Right.
And if it doesn't work well, it just gives dysfunction in the entire area. Psoas, erector, and very often you see a reaction of the piriformis muscle as well. You get this well-known piriformis syndrome, where the ischias is being compressed and you get some sensation in the usually just upper leg and not going all the way down to your feet.
So since the adrenals are very much in basically relationship with the kidneys, do you notice that there's a
To flee for a predator, it is not very good to leave our urine or faces behind us because we would be easy to follow.
I see, yeah.
Okay? In our own territory, we can go to the bathroom, we feel well, and we can relax there. Outside of our own territory, maybe not so well, so people can tend to get some bladder or kidney problems. A pigeon doesn't have a bladder because a pigeon can fly away and can drop everything he wants to anywhere. They have a cloaca. Everything goes whenever they want to.
That makes total sense. When you travel, your environment changes. I mean, it's a huge factor that you need to think about because we
Yes.
don't factor that in. Even though his territory is a little sweeter because I'm here with him. I mean, we don't have our children, our dog, the environment that he normally has, the schedule. Yeah, that all impacts it. But I honestly believe that this kidney issue has been a ongoing, like an old issue.
That's interesting that you said it because you know him best, and you know his psychology, emotions better than any of us. And I am not. You cannot say that there's something that's going wrong with the kidney, that he has a territorial problem. That would be turning this, everything around. But like trying to explain what's going on with a kidney, what can be wrong with a kidney, the territory might be a part of it. If you say that, well, that could well be, I believe it because it is stuck. Now it starts to move better now.
Do you feel it, Rob?
I mean, it's just really uncomfortable, but I can definitely feel there's more movement. I mean, for sure that he's moving that around.
I mean, in all honesty, how many of us are really in touch with our organs? Like, how many of us
Right.
can sit there and be like, I can see that the
Exactly.
kidney is moving out of the sac. I mean, nobody feels that for sure, but he does feel that there's something changed, something
Absolutely.
Oh
different.
yeah.
I mean,
Well, at the start I could hardly move. I could hardly move it, and by now there is a good movement in the left kidney. I have to do a little on the right one as well, but that one is not as bad as the left one.
I mean, this definitely, I mean, obviously you're not pushing as hard, but I definitely don't feel nearly as much as I do on the left. Like, I feel a little bit now, maybe as he gets deeper into it. Yeah, I mean, I definitely felt it was almost as if that left side just would not want to move.
The left side was a lot more intense, but that was already told to me by his
Yeah.
body touching the sacral bone and feeling this rotation going to the left side.
Yeah. And I noticed that I feel you keep checking my sacrum.
Right.
With your left hand just to see what. So what are you feeling for? Are you just looking for movement or
Movement.
Okay.
I want the mobility, the fascia to move freely. And
okay.
if I can move your sacral bone, I'm moving it right now to see what it's doing.
Yeah.
I want it to move freely.
Mm.
If it's free, you're good to go.
Okay.
Because that is a checkpoint for the fascia going up or down.
Okay.
Now, I also saw that during rotation and then your flexion in the direction of the collarbone to the left was very well. Going to the right, you still had a little limitation. Okay?
Yeah.
Your flexion to the left was a little better than to the right. So we'll be looking at a couple other things too. I think that kidney on the right is not that bad. The left is good now too. If I check that under the sacral bone, I now have a feeling just going up and down again. So there is a rhythm in that too.
Yeah.
It's not the cranial sacral rhythm, this is something different.
Okay.
Cranial sacral is different.
Okay.
It's going up and down. So we have movement. And it can also go in all other directions. So it's moving freely now.
Yeah.
And that is also very good for your total pelvic bottom. A lot of women with pelvic bottom problems.
Yeah.
When you feel the sacrum, it is, even if they just got 50 kilograms, which is 110 pounds, it feels like concrete on your hands. And you can have people with about 280 pounds, they lie on your hand and they say, can you stand that? Hey, light as a feather. If nothing is going on, it's fine.
Yeah.
It's like fluidity going to my hand and there's nothing going on there.
I see.
If there's dysfunction,
Yeah.
it's as hard as a stone. It's a rock on my hands.
Wow.
And that's just controlling what does it do, where does it go to, and what is happening. Okay.
Yeah, that deep front line of your fascia is one of the most interesting lines because it's got that relationship with the kidney, with the adrenals.
Yeah.
If that's not working, then it affects the fascial line. If the kidney adrenals are overactive, then you get sensitization of the spine.
Stand up.
Shares the same sympathetic nerve supply, which makes the line tight anyway. Then you make too much adrenaline, and that also makes the muscles tight. So it's like a triple whammy.
I didn't do anything up there, right?
Right.
I still want to see how you're doing. Turn left and then go to, okay, you're touching there.
Yeah.
It's a little more down than it was before.
Yeah, it's better.
I was only working down here. Now the kidney is not just going into the pelvic area, it also goes up. You have the pillars of the abdominal diaphragm in the back, and the kidneys go through there, have a lot of connection to your diaphragm. Your diaphragm going up, 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 up.
Right.
So there's a big connection to that one as well. Now just doing the kidney also did something here.
Right.
Okay? Still going to look at the diaphragm, so
Okay.
if you lie down again.
Yep.
Diaphragm is a very important structure. You have a liver hanging on there. You have a stomach hanging on there. There's a lot of structures going through. So a stomach over the esophagus hanging on, going through the diaphragm,
Right.
going up, having a connection to C7, the ventral side of the vertebral body, C2, and then your occipital bone,
Yep.
front side. If you have a lot of tension here in your stomach, and I think a lot of your patients have that,
Right.
a lot of tension in their stomach, and they tend to stand like this.
Right.
They have headaches, they have neck pain, they cannot turn,
Correct.
and if you release the stomach, they can get up again. Stomach is a muscle. You cannot say stomach flex or stomach relax.
When you say stomach, you're talking about diaphragm.
No, I'm
No.
talking about the gastric.
The
stomach.
stomach.
The
Yeah.
gastric muscle.
Yeah.
Stomach.
So
Okay?
so that, okay.
But the stomach has its effect on the diaphragm.
Yeah.
As the liver has its effect on the diaphragm, because the liver, the area nuda, is connected directly to the diaphragm.
Yeah.
Very interesting is stomach, diaphragm, heart. A lot of people with heart problems have a problem with their stomach. Their stomach is pulling everything down, so the heart cannot move as well as it should, pumping. And if you're pulling on a sleeve, the sleeve gets restricted.
Restricted, right.
And if you do that on an arteria or a vein, well, you might get some kind of heart problems.
Right.
You might get fibrillation problems in the heart. So this stomach is a very powerful thing in combination with the diaphragm and going up. Now your stomach is good, but your diaphragm still has a little tension.
So, people, if they do have acid reflux, there's several factors with that. But then if they've been diagnosed with a dysfunctional lower esophageal sphincter, is that something that you can manually manipulate, work
Yes.
with to try to get that functional?
Yes, the sphincter is around here. But when you have this sphincter, very often you have a problem with more sphincter. So you have one here, where the ductus of the gallbladder and the pancreas come into the duodenum.
Right.
And when that one is also a little tight,
Yeah.
you cannot get your pre-enzymes from your gallbladder and your pancreas into your intestines, so your entire digestive system is getting problems.
Right.
If you do not loosen those up,
Yeah.
you can eat as clean as you want to, but you don't have the enzymes coming in there to digest,
Correct.
and you still have your digestive problem.
Problems. Yeah.
The third one we're talking about is the ileocecal valve. That is the connection of your small intestines to the colon. It's down there on the right side of the lower belly, and this one usually, or very often, is a problem. It's very tight. has a lot to do with bacteria. So if your guttural bacteria is screwed up
Yeah.
due to interest in nutrition,
Right.
you have a problem. And now you can start eating well, but still you still have this problem because it doesn't move.
Right.
If you release this and you get the better bacteria
Yeah.
and you have a better nutritional program, then you can excel. Okay?
Yeah.
People having problems or having deficits in their nutrition, you every once in a while you can feed them or give them supplements that just can take them in, because the intestines are so tight, have so much tension in them, that they're just stressed. And if you are stressed, you have to leave something alone. When you have to prepare for a speech at the summit,
Right.
you may have a little less time for your children. Not you, okay, they're more important. But something has to suffer, because you cannot do it all.
Yeah.
Now your small intestines have the same problem. So we have a little tension of the diaphragm there. This might hurt a little. Okay. We're going to do this 5 times. 5 times breathing in and breathing out. Breathe in deep. And out. Breathe in. In. Breathe in, Robert. And out. That's breathe in. Breathe in. Breathe in. And out. 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 Good. Breathe in. Breathe in. Breathe in. Breathe in. And out. Relax. Breathe out. Breathe out. Let it go out. 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 Breathe in. 2 more. Good. And out. 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 Breathe out. Relax. Out. And the last one. So how's that compared to kneeling?
I would take needling hands down over that.
Boom.
Holy moly.
Did I promise too much when I said it was going to hurt?
Oh. No, you over-delivered on that one.
How does it feel now?
Wow. That was good.
No, it was not good. It was about
No.
the worst sensations you have had the last 6 months.
Yeah,
But-
but
He'll never admit anything.
that was the worst sensation
He's a
I
man.
had
Yeah.
in the last 6 months.
But it's
for
gone now,
sure.
right?
Yeah, oh, that
Okay.
it's
You
completely
get up
gone.
again.
I mean, once you released, after I took that breath, then it was like, oh, that was unbelievable.
Turn left. Flex.
Oh, jeez.
Turn right. Thank you.
Oh,
Nice.
See the difference?
Yeah.
that's different.
Now-
I was like,
Show it again. Because
so yeah, before, I mean, that's so easy to do that, and then before I was like this, and now I'm like, no problem.
so that is relaxation of the diaphragm,
Diaphragm.
and that one is so important.
Yeah.
It is a muscle. You can train
Right.
it. You can by breathing,
But I mean,
right?
no, what you just did to release it was just,
Oh yeah,
I
that
mean,
release
that's-
it was needed
Yeah,
because your kidneys have been pulling on it so long.
yeah.
It gets tenser and tenser and tenser.
Mm.
And now by getting this abdominal diaphragm release,
Well, I mean, it was like,
it hurts, but
yeah.
hey, that's
Oh,
it.
thank you, brother.